I'm Dr. Tanushree R. Peters, a pediatrician practicing at Rainbow Children's Clinic in Siliguri. Today, I'm going to talk about a very sensitive yet neglected issue, and that is prevention of suicide in adolescents and intervention. 10 September, as you know, was celebrated as the World Suicide Prevention Day with a very inspiring theme, and that's creating hope through action. Through my video, I want to create awareness about this menace of adolescent suicide, which has grown exponentially with the onset of the COVID pandemic. Adolescents form 21.8% of our population, and their physical, mental, and emotional well-being will determine the health of our nation. India has the highest incidence of adolescent suicide in Southeast Asia. Every hour, one student commits suicide. Most common causes of adolescent suicide in India are family problems, physical and mental illness, school failure, broken love affairs, drugs, and sexual abuse. For every unfortunate suicide, there are 20 failed attempts and countless suicidal thoughts. But fortunately, 4 out of 5 teenagers give clear warning signs which can alert the caregiver or the parent to take remedial action in the form of counseling and support. Any subtle change in the teen's behavior or attitude cannot be missed by vigilant parents, especially if they are of a recent onset, an increasing severity, and persist for more than 2 weeks. Let us know what are these signs or pointers towards suicidal intent. The first, verbalizing. An adolescent might express his death wish, which could be either by writing, talking, or texting on social media. Writing things like, "I should never have been born," or "I wish this was the end," etc. Next is acquiring means, which includes collecting weapons, ropes, pills, train timetables, searching the internet for ways to do self-harm. Third is a feeling of hopelessness that seems to have engulfed this young adolescent, a sense of being trapped, that nothing better will happen. This is more so during these COVID times where people are confined to their houses. Fourth is self-hatred, a feeling of guilt, dislike for self, disturbed sleep or appetite, mentioning things like, "I'm a burden to the family," "I'm of no use." Fifth is getting things in order, like giving away certain possessions and valuables to friends or siblings, or sometimes closing their bank accounts. Sixth is saying goodbye, making unexpected visits to friends and relatives, bidding goodbye as if this is the last time. Seventh is being socially withdrawn. The child becomes withdrawn from friends and family. There is a deterioration of the social relationship. There could be excessive anger or aggression, and a fall in the academic performance. The last pointer is high-risk behavior like reckless driving, drug abuse, consumption of alcohol and tobacco. If you see these signs in your teenager, talk to them. Consult your family physician or your pediatrician and seek the help of a trained mental health professional to assess the risk. Try to identify the stressor from your end. Motivate them to adopt a healthy lifestyle to combat stress and adversity. Most importantly, impart life skills to your child from a very tender age. The core life skills include: number 1, self-awareness, the ability to recognize one's strengths, weaknesses, likes and dislikes. Number 2, empathy, the ability to understand others' emotional states and perspective. Number 3, creative thinking, ability to visualize and analyze things in novel ways and to think out of the box. Number 4, problem solving and decision making. Try to involve them in the little decisions that you keep taking for your family. Number 5, teach them to cope with stress. Daily moderate physical activity for 1 hour, like jogging, swimming, spending time in hobbies, prayer or meditation is very important. Eating a balanced diet and adequate sleep of at least 8 hours is almost mandatory. Number 6, They should be taught how to cope with emotions in an appropriate manner, not to keep it bottled up or suppressed. Effective communication, both verbal and non-verbal, to deal with negative peer pressure is also equally important. Lastly, maintain a healthy interpersonal relationship with friends, family members, neighbors, and colleagues. And this is of utmost importance for mental well-being. Adolescent suicides can be prevented if we, as parents, are a little more observant. Subscribe to my YouTube channel, Dr. Tanushree Peters, to know more about parental guidelines on various diseases and keep yourself updated.